This is a very exciting topic and something completely new that my colleague, assistant professor at Icahn School of Medicine, Dr. Santiago Thibod, has been leading. He actually started this during his fellowship and now has amassed a huge amount of data, more than 1,500 patients studied, where he has consistently found this theme that about 8% or so of myeloma patients have germline mutations and a predisposition to get myeloma that is carried on from individual to other members in the family. So there is an inherited predisposition to myeloma, which we previously never considered to be a familial disease. And a lot of these are in genes that we already know as causative for familial cancer syndromes, genes like BRCA1 and 2, which cause breast cancer, genes that are causative for colon cancer. The common theme amongst all these genes is that they disrupt the DNA repair mechanisms. And in fact, the fascinating thing about this is that when patients have these mutations, they actually respond better to certain chemotherapies. In myeloma, particularly alkylator agents, which are used in autologous stem cell transplants, seem to help these patients more than patients that don't have these mutations. So we could actually think of separate therapeutic pathways for patients with these. In our own center, we've actually created now a screening pathway with the help of our genetic counselors, and Santiago is working closely with them to screen these patients and their families, because this is important not just for them but for the next generation. And we are going to publish results on our initial cohort as well as subsequent screening results very soon. And this is going to be something that will change our initial conversations with the patients as we come across younger patients that have family history of myeloma or other cancers, or patients that have second malignancies. This is all going to be important to think about having these germline mutations and referring them for genetic counseling for screening.